Welcome to the first ever Fireside chat for treatment.com AI. Today, we're going to be talking about the acquisition of Rocket Doctor. And I have with me Dr. Issam Hamza and Dr. Bill Cherniak. Welcome to the show.
Thanks, Penny.
Thanks.
All right. So, first up, I'd like you both to give a brief introduction.
Sure. Yeah, absolutely. I think, the investors, I think, know who I am already as the CEO of treatment.com AI. Don't have to go into my background too much, but I will say that we're very excited about the acquisition of Rocket Doctor and the addition of Dr. Cherniak and his team. I'm going to hand it over to Bill to kind of introduce himself and a little bit about Rocket Doctor, if that's okay.
Please.
Great. Hi, everyone, and hi, Penny. Thanks for the chat. So my name's Dr. Cherniak. I'm an emergency physician, also trained in family practice and global public health. Did my clinical training across Canada, and then went down to Hopkins to do a master's of public health, spent some time at the NIH, the federal government doing a global cancer control fellowship, worked for Kaiser Permanente for a little bit in South Baltimore, and had a really interesting experience managing folks on Medicaid in Baltimore City. And then moved out to Los Angeles, where I started teaching at University of Southern California for a few years and bouncing back and forth from the West Coast to the East Coast to East Africa. And the reason for that is my first startup was actually about 12 years ago in the nonprofit space, a group called Bridge to Health, Medical and Dental. And through Bridge to Health, got involved in high-tech diagnostics, particularly with points of care ultrasound, cloud-based teleradiology. So actually had some press in the New York Times in 2019 around that, pushed me personally into the tech sector. And then as an emergency physician, and as mentioned, working with some of the most vulnerable patients coming to the hospital really with issues that didn't need to be there with outpatient primary care needs, was thinking if we could combine high-tech diagnostics, virtual care, we could extend access and improve the system generally. And then, of course, working in a corporate healthcare system, the idea was, how do we empower physicians to take control of our practices? And all of that culminated into Rocket Doctor in the fall of 2019, but really picked up in the spring of 2020. And important to note is that we're not a teledoc, we're not a virtual walk-in clinic, virtual urgent care. As mentioned, we're a Shopify really for physicians, where we're really helping doctors to build and scale our independent practices, largely virtually, but it's really interesting hybridized in-person and virtual models of care. For example, in New York City with federally qualified health centers in Manhattan and the Bronx, in British Columbia, where we have longitudinal family practices, and a variety of partners across North America, where we mesh that in-person and virtual network. And then we take all those doctors, we put them out to patients in rural, remote communities who may lack primary care, family doctors, and are on Medicaid in the US market. Health insurance for folks at or below the poverty line, pregnant women, children, some 90 million Americans in the $700 billion market. And we build all the software and systems that powers that entire ecosystem, leveraging our HIPAA-compliant proprietary EMR we built over the years. So that's us in a nutshell. And we've now done 500,000 patient visits with 300 physicians across North America. And I'm excited to join treatment and expand.
All right. Well, I guess I'll ask you both separately then. Dr. Hamza, how will this shape treatment going forward?
Yeah, no, it's incredibly exciting for us, and the reason we really, went after this partnership or this acquisition is that we see it as a partnership as well. Bill has built a great brand. It's a brand that is trusted. It's a brand that is. I've never seen that kind of support from doctors on the platform before. They are actually coming in for weekly meetings and supporting the growth of it. They're excited. They're actually shareholders in the company as well. When I presented to them, they were very excited about where this is going. They believe in the future of using technology to improve their own lives, but also the patient lives as well. So I've never seen that. These are not doctors that are, clocking in and out, or a telehealth company. These are all partners in shaping where this is moving. So we're going to be supporting the Rocket Doctor brand in its expansion. I see this three ways. I see this, number one, in that Rocket Doctor is growing very, very quickly on their own already. We kind of alluded to it in the press release on the internal numbers of growth year over year. They have very aggressive earnout projections as well as part of this agreement. They're shareholders of treatment now, so it's for the greater good of treatment to do well on top of that. I see this secondly as the ability for us to hopefully improve those numbers both on the top line and the bottom line, where we can introduce them to other partners that we've already have access to and maybe increase their business on the top line. But on the bottom line, we did announce the Aaliyah Health and the voice agent, the conversational voice agent a few weeks ago. Imagine now a virtual nurse calling or being on the portal and doing that all verbally with the patient, and in terms of talking to them with natural language and different languages, and being able to onboard them and help triage to the right physician or the right allocate, like maybe it is going to emergency, or maybe it is going to see telehealth, or maybe it's connecting with a nurse or the MOA head of the visit. So helping where we think it's going to move in terms of onboarding and triaging. And then thirdly, it actually is a proof of concept and a showcase for GLM now, the Global Library of Medicine. Now we don't have to talk about hypotheticals of how the GLM could help. We can actually show it in real life in terms of how it helps all the stakeholders. The doctors hopefully will love it in terms of getting rid of a lot of their admin work. The staff hopefully will like it so that they're not fielding calls nonstop, and they can actually manage a lot better and really help out. The patients hopefully will love it, because now they're not frustrated about busy signals or trying to get through to somebody and getting better access 24/7 to some sort of care. And hopefully we can actually improve the bottom line, with all that as well. So we're really excited about this, and we think we have something in terms of partner with Rocket Doctor and Aaliyah that we can really build a powerhouse of a company.
Perfect. So almost the same question for you, Dr. Cherniak. How does this impact Rocket Doctor's long-term mission?
Yeah, I mean, similar to what Isam said, the idea here is that we were already growing at a healthy pace every year, have a bunch of ideas, plans for the future, including how to leverage advanced technology to reduce non-clinical administrative duties for physicians to make our lives easier and also to improve the patient care experience. And so, now we've got the benefit of a broader team, that Global Library of Medicine that you heard about, the ability to engage artificial intelligence and other smart tools to talk to patients in advance of their visits and support physicians who practice medicine, just build a better ecosystem that will really continue to grow and scale even faster.
All right. So as a treatment.com AI investor, what I'm also very excited to see about in this is the unaudited ARR SaaS revenue. So revenue is very exciting for us. I mean, this has been a very well put together plan, and seeing it get to this level, I'm excited. But help me understand your revenue model a little bit better. I see your SaaS, but I also understand that there's billable service dollars, and I'd like you to kind of break that down for us.
Yeah, I mean, it fits back to my sort of opening salvo about how Rocket Doctor is different from the Teladocs of the world and the other virtual care or virtual walk-in clinic companies. Now we're different in that they would reflect as their top line gross revenue, the total billable dollars that a physician or their practice group bills to the payer, to the insurance companies, and then they would pay 75%, whatever that is, to the providers, and they would have 25, 20% margins, that kind of thing. For us, we don't kind of play that shell game, and we reflect the gross billings more as a GMV, as a total billable, just to give people an idea. But our gross revenue is really, as a technology company that powers doctors to practice medicine, we reflect the true amount that we're paid as a company. And then we have something like 88% margins off of that. And it's interesting because we're just scratching the surface of how we can expand the pure technology sales in building these solutions that actually will now take larger practice groups, health systems, and sell them RTAC to expand with their existing providers, as opposed to just onboarding physicians that are coming in a more one-on-one basis. So that's really the exciting part for the future as well.
Oh, okay. So I'm understanding that this isn't a Teladoc sort of situation, and I know I've heard Rocket Doctor referred to as more of a Shopify. So can you talk to me in terms of scaling for physicians?
Yeah, I mean, for the independent doctor, like we don't really have the ability to just sort of go in and quickly seamlessly start our own practice, particularly in the United States these days, where it's become the par for the course to have, private equity firms rolling up a bunch of physician practices and making them, national across the country, and doctors really lose our autonomy. So the idea from our perspective is how do we empower physicians to really be independent? So we're able to provide, revenue cycle management, payer enrollment, credentialing, technology, but also the ability to provide access to care for patients on Medicaid, which typically would be far too complicated to deal with the sort of government funded health insurance in the United States. And then in Canada, the model across the country typically sees physicians as being more independent in general. And so we just, rather than try to emulate the corporate model into Canada, like some of our competitors have done, we said, okay, let's build in the Canadian healthcare system. Let's let doctors continue to be autonomous and independent, use their own single payer billing numbers, create their own practices. And so what that looks like is if, a doctor is a respirologist and they want to do their work on a platform, just like Shopify, we can create a storefront for them. We build a customized intake page. It doesn't take a lot of work on our end. They can then put that out to their clients. They can book follow-up visits. They can do all of their referrals, lab testing, imaging. But now they've got the luxury of having access to 300 other doctors across the system, all on the same cloud platform. Family physicians, emergency doctors, social workers. So, you can access this integrated, almost virtual hospital online, even while you're entirely independent, which is really neat.
Okay.
20, sorry, Penny, I was going to mention, I think there's like 20 different specialties, Bill, already. I mean, it's a pretty wide spectrum of different specialties around the system.
Correct. So their biggest groups being in mental health, so psychiatry, psychotherapy, and then addictions medicine as well, substance use.
Okay. Wow. So, Hayne, I know you had over 88% growth in ARR between 2023 and 2024. So it's clearly working. I see you're in the US and in Canada, and being able to build Medicaid and Medicare. This sounds to me like there's a lot of growth potential, right? Pretty simple. It is growing. I wanted to talk about, I noticed in the press release that we're talking about a 450,000 member managed care. That seems like a pretty big pickup.
Yeah. And what's really exciting is most entities will never be able to get a single contract with an insurance company or a managed care plan. And so the hardest part is always getting your first, as I always say. And so now that we've got our first, we've got many more that we're in touch with and sort of working through. And I think there's huge opportunity when you think about, the state of California has 15 million people on Medicaid. This plan has 450,000 members. It's already a huge number of folks. Think about it as if you look at average utilization of these kinds of programs, even at a 10% uptake rate, that's something like 45,000 visits a year. And our model is charging $18 per patient visit to the physician. So
that sounds like a massive opportunity. So can we talk about this from both the physician side for the time savings for them as well, and then the patient experience?
yeah,
Maybe.
on the
Do you mind if I just say one last thing? You can maybe bring into the last question here, Penny. But what Bill kind of alluded to, and you did as well, I think a little bit, is that the revenue that's so far been announced has been about, I would say, 95% Canadian revenue, Bill, 5% US, and so with the growth in the US and California, New York, Maryland, and hopefully other states soon. I think the target's going to be much higher than that, and I don't think it'd be unreasonable to think that, over time, a third of that, very quickly could be coming from U.S. revenue as the ratio changes, and this revenue is recognized over the next year and the following years.
Yep.
All right.
Definitely.
Excellent. So back to time savings and patient experience, because I think this is where the products really work so well together and benefit both parties.
Yeah. So from that perspective, I mean, we already built, Esau mentioned how he joined a session with some of our physician leads across the country and how folks are bought into the vision of our system and are in fact themselves investors. otherwise. And those same doctors are actually embedded in every element of our product development. So as we built our HIPAA compliant proprietary electronic medical record system, we had doctors that looked at every single button and tool, said, does this work? Is this going to make my clinical workflow better? Does this serve the purpose that I'm looking for? And if the answer was no, we got rid of it or we did it differently. And so that allowed us to build a system that already is ultra efficient. So, there was a report that came out, a study a couple of years ago, that it can take up to 42 clicks to prescribe Tylenol at a typical health system. On our platform, it takes 3 to do a prescription. It's easy, fast, efficient. And now as you start to add in these AI tools, not only are you getting the benefit of the core stuff you already do, but you're getting these added perks where you have the history presented right to you when you join your session, everything about the patient's past medical. You already have, you can formulate what your differential is, what questions you want to ask, what you want to do as your management plan. And then as we start to build more tools, then you can actually start to manage the patient using those tools also to speed up. The 3 clicks is great, but what if you don't have to click? What if you can just talk to the thing and tell it to, take care of this for you? And these are the directions that we're going in the future.
All right. Well, what will be the most difficult part of putting these pieces together?
With any acquisition, there's different parts. So there's financial acquisition, or merging of the back end, and there's legal, and then there's tech, right? And so tech, we got to be careful not to disrupt a good thing, and so it's about supporting, and we're not changing and merging 2 platforms completely, whether everybody likes it or not, kind of thing. We're listening to the end user here as well. I think there's an opportunity to, with our platform, where it is a bit of a plug and play, and we have APIs that can connect to any platform, to showcase that fact that that this is going to be a platform that we can connect to with an API, with no disruption in their own operations as well. And so we're going to talk through it with Bill and his team, as well as the doctors. But we already kind of alluded to it, and they're on board with that idea. And I think, incorporating the voice agent with the parts of the GLM, doesn't even have to be the full GLM, for onboarding and triaging patients, is probably going to be the first thing we look at. What Bill alluded to a little bit in that last response was there's an opportunity for post-visit care as well, and follow-up of managed care of chronic care patients or mental health patients between visits. And so there's really longer term opportunities just outside of this. One thing we didn't talk about is what his team's already built in terms of the virtual immersion rooms. I think that's a huge opportunity personally, because it's a big problem for governments around the world. And so maybe, Bill, you can kind of talk a little bit more about the virtual emerge that you've created and what opportunities there are there.
Yeah, for sure. I mean, the current system that we've already built empowers patients to basically come in anytime they're thinking about requiring an ER visit. And we published a study in the Journal of Telehealth in 2023, where we surveyed thousands of patients across the platform. And what was interesting there was 33% of patients said they would have gone to an emergency department had Rocket Doctor not been available. Another 50% said they would have gone to a walk-in clinic. So almost 80% of people would have gone somewhere for a walk-in or ER, but were managed in a virtual ecosystem. And then, to Isam's point, we have a specific partnership with a hospital called Georgia Bay General in Midland, Ontario, and we've had that for almost 3 years now. We've had over 3,000 patients that have come through, and for patients, it's something like 97% satisfaction. And out of the whole group, only 1% of patients were sent back to the ER after the visit. And these are people that actually were going to go to the emergency department, but were redirected to virtual care. Through their own accord, they decided to do that virtual visit. Instead, only 1% have to go back to the ER at the end of the day. So the system works and it's scalable, and we're looking at other ways to expand that.
Wow, looking at my local emergency rooms, that would ease so many clinician problems and the rest of the public who actually have a medical need to be there. I mean, the amount of time that's wasted on having people actually physically in there to be triaged for things that are really low acuity concerns. And then having, people coming through that have, major issues that need more time with those clinicians. So that's very exciting.
Thanks. And that was the whole idea, honestly. That's how the whole company sort of started in my mind, because of being that emergency doctor in the department, seeing patients that I knew didn't need. And I still work some shifts every, few shifts every couple of months. And I'm always reminded think to myself, okay, this did not need the emergency department. This could have been managed in an outpatient setting if they had known they could have used the service. And so that's the whole idea, is how do we continue to embed within the system to improve those outcomes?
All right. So I guess, that 88% growth in ARR between 2023 and 2024, being able to bill Medicaid and Medicare, being in Canada and the US, already being at 500,000 visits. Like these are all some really, really special things that stand out. Cause I look at a lot of, technology that's trying to compete. And I see a lack, a lack of actual execution. So this is really pleasing to see. And I'm happy for other treatment investors now to be investors in Rocket Doctor too. I mean, that's a nice acquisition. That's a partnership at its core. So very exciting. Is there anything either of you want to make sure investors know before we go?
From my end, I think we covered a lot of the stuff. There's a lot more we can talk about, and there will be a lot more we can talk about, over the next few weeks and months and so on. So we're just very excited to bring Bill and his team on board as both partners and investors. I think there's going to be a lot more to talk about, in the future. Bill, I'll hand it over to you. I know you're off onto a plane very soon as well, so you can go ahead.
Yeah, at the airport at the moment, about to board shortly, but and hopefully not delayed too much by the crazy snowstorms across the continent. But no, I would just echo what Isam said, and it's great chatting and getting the word out to folks on the treatment side of things. And I think this will be great actually for some of the folks on the Rocket Doctor side of things to learn more about the deal as well. And yeah, it's exciting that we're just getting started in a new chapter, and onward and upward.
All right. Well, this has been great news, and I've really enjoyed this fireside chat. So thank you both.
All right, thanks.